in high definition. This is KCAL 9 News at noon.
It is Heart Health Month, and there are no more excuses for not getting a checkup. The Heart Bus is heading to a neighborhood near you. We'll have details of that coming up.
The Heart Bus, there it is, in our parking lot right now. It's a mobile clinic touring the Southland to give residents heart health screenings. We have details coming up.
Our Health Watch continues here this afternoon. Coming up next, we're showing you a new way to monitor your heart health. It's the Heart Bus, and Sandra is jumping on board to give us some tips we need to keep our own hearts ticking away.
February is Heart Health Month, and we know that heart disease is the #1 killer of men and women here in the United States. So today we brought the Heart Bus right to our parking lot here at the Broadcast Center. James Ekbatani joins us now. And James, you're the founder of HealthFair and also the owner of this amazing vehicle we're in.
Yes, thank you so much for giving us the opportunity to be here. You know, cardiac disease is the #1 killer in the country. More than 40% of all deaths occur because of cardiac and vascular disease. So we're doing something about it. We're teaming up with a number of hospitals nationwide, including Good Sam Hospital here in Los Angeles, to bring these testing to the public and where places people work and live, in order to avoid this cardiovascular epidemic that's out there. 60% of all heart attacks occur with no prior warning. And so with a series of simple tests and a very low cost, we can detect pending cardiovascular issues in a very quick period of time and let the physicians look at it and get the reports back to the patients throughout this study area.
And James, you mentioned that a lot of times there's no warning sign that you're having a heart problem. So I guess a lot of people don't really go to their doctor and say, check my heart, if there's no indication that anything's wrong. So we probably are ignoring some problems.
That is the root cause of the problem, because we feel good about it. We don't necessarily take the time to go through the test. And also the healthcare system is such that if you don't have any symptoms, a lot of physicians unfortunately cannot order these tests. So we're just preaching to the entire population, saying please come in and get these tests done for a very low cost, and we will find out if you have an issue, that then you can take it back to your physician with a report card. We issue a report card to you. You can take it back to your doctor for follow-up care. Something that happened to me was when I was 40 years old, I had a stroke myself. No one told me about it. I had no symptoms whatsoever, and all of a sudden I found myself in the ER. So we're trying to avoid that, and fortunately with the hospitals' help that we have, 40-some hospitals, we can get to the bottom of it and get people to the right care that they need.
All right, we have a patient on the table right now. John Davies is here with us. And what exactly are you checking for when you use the Heart Bus? What sort of test are you doing on the patients?
Typically there are 6 tests that we conduct from the neck down to the ankles. This particular test that John is going through is a carotid ultrasound. You can see the images on the screen. Basically we can show the color flow, the flow of blood to the arteries, to see if there's any plaque in the arteries. The excess plaque in the arteries can lead to a blockage of the arteries, which means a stroke, an imminent stroke. So we're just trying to find out if there's any blockage. We then further on move down and check the heart, and do what we call an echocardiogram to find out if the heart is working properly. We look at aneurysm inside the stomach to make sure there's no aneurysm, and then go to lower extremities looking for blood flow to the legs and the arms. John happened to have another test, which was a single finger stick test to detect prostate cancer, and fortunately we detected it last year, and he did something about it. So he's here to tell you more about what we found out.
Yes, John, I understand that last year you came to the Heart Bus. You didn't have any symptoms, is that right?
Sandra, I had no symptoms of prostate. I did have a genetic predisposition to cardiovascular, saw the ad in the paper, so I called up and they said, well, would you like a PSA test? And I said, yeah. And all my heart tests came back, and I had great peace of mind out of that. That's what I got. I did find that cancer, but it was early enough to get a remedy. So that has kept me alive.
Yeah, that's the first thing you said when you introduced yourself to me this afternoon, was that it really did save your life.
Absolutely. The thing is, my view was, really, it's not going to be preventive or curative surgery that does the damage. It's the stroke, the heart attack, or the cancer. You know, and so the message is, get out there, get screened early while you're still young and easier to fix.
All Right, John. Thank you very much. And James, I understand that's one of the benefits to having this bus is you can go right into the communities and get people to come out, have their testing done who might not otherwise be encouraged to go to the doctor.
Yes, it's about ease of access, and so we are different pharmacy chains throughout the country, and also hospital locations. And again, Good Samaritan Hospital is sponsoring this here in Los Angeles, and all you have to do is go to healthfair.com or goodsamhealthfair.com. Or if you like to call, you can call 1-800-6-TEST, SIXTESTS. And so the 6 tests are for $179 in cooperation with the hospitals. And if there's any abnormality, hospital personnel will then follow up by calling you to making sure you get the care that you need, so that unfortunately something like this doesn't go undetected and create a catastrophic event. We're trying to bring prevention to everybody and encourage everyone to take advantage of these tests. We'll go to the places of employment. We go to where they live. Bottom line, we want everyone to get tested, and just if you feel good, don't feel like everything is fine. There may be an issue that you need to know about, and we're trying to bring that message out to everyone.
It's a great idea, James. Thank you so much. John, thanks for being with us. For more information on where the Heart Bus is going to be, just go to our website. It's KCAL9.com. When we come right back, Rich has another check of that rainy, cold forecast. We'll be right back.